we're going to continue on with your nutrition prep for your Kaplan. Now, you're going to need your Kaplan Basic book. Also, your Kaplan content review would be helpful, and also your fundamentals book. In the Kaplan Basic book will be starting on page 195. In the fundamentals book will be in chapter 26 and 27. So we'll start off at the point at which we left off with water-soluble vitamins. Now, the first one of those is vitamin C. A lack of vitamin C can result in scurvy. Although it's rare, older adults or people who have used alcohol can develop scurvy. They would have bleeding gums, petechial hemorrhage in the skin and mucous membranes. They could have bleeding in the eyes, hyperkeratosis, and what's called Zika syndrome. Another water-soluble vitamin is thiamine. This is also another vitamin that you would see a deficiency of in people who abuse alcohol. Vitamin B1, which is thiamine, is absorbed in the jejunum, and thiamine levels in the small intestine is low. An active transport portal is responsible for the absorption. Small intestine is where phosphorylation of thiamine takes place. The body cannot produce thiamine and only stores 30 milligrams in the tissue. It's mostly concentrated in skeletal muscle. Foods that are rich in thiamine are things like whole grains, meats, fish, poultry, and eggs, milk and milk products, vegetables, particularly green leafy vegetables, legumes like lentils, soybeans, nuts, and seeds, and also orange and tomato juices. It's found in the brain, heart, liver, and kidneys as well. Fat-soluble vitamins are A, D, E, and K. These can be stored. You can also have a toxicity in excess of these vitamins. Vitamin A is connected with visual acuity, and we find that in egg yolks and dairy items. Also yellow fruits such as oranges and green leafy vegetables. Vitamin D helps us to absorb calcium, and vitamin D comes from sunlight. You can get your vitamin D by having your limbs in the sunlight for 10 minutes a day. So that's how you can get your vitamin D. Also, we get our vitamin D by fortified dairy products. Vitamin D isn't in milk naturally. It's actually put into the milk. Vitamin E, which is an antioxidant, is found in green leafy vegetables, nuts, grains, and oils. Vitamin K, which is connected with blood clotting, is found in leafy vegetables, eggs, cheese. It's also synthesized by bacteria in the intestinal tract. They say that the more bumpy or frilly the leafy vegetables, the more vitamin K that they have in them. Now, vitamin D, we can obtain that from two sources, sunlight and consumed food. Sunlight, it only takes 10 minutes a day. Also, cod liver oil is a potential source of vitamin D, and some orange juice, soy, and rice beverages are fortified with vitamin D. Vitamin K, as I said, is a cofactor that's needed to synthesize some of the substances that help our blood to clot. Chronic illness, malnutrition, and alcoholism, also liver disease, gallbladder disease, or cystic fibrosis can cause low vitamin K. Long-term use of drugs such as antibiotics or cholecystérines, which bind to bile acids, can prevent fat-soluble vitamin absorption, and so that can cause low vitamin K as well. The vitamin B's, water-soluble vitamins like thiamine, which is B1, it helps with growth, carbohydrate metabolism, and and is deficient with excess alcohol use. We always see alcoholic 7 deficient thiamine. Riboflavin is B2, and that has to do with protein and energy metabolism, and we can find that in milk. Niacin, which is one of the B vitamins, has to do with growth and maintenance of skin. Folic acid, also one of the B vitamins, can prevent neural tube birth defects. That's why when women are pregnant, they are given vitamin supplement with folic acid in it. B12, which is connected to nerve function and only found in animal products. B12 is also connected to the production of red and white blood cells. Vitamin C, collagen synthesis, and is also vital in wound healing. So we need vitamin C when we're trying to heal from wounds. Also from burns, they try to make sure the person has plenty of vitamin C when they're trying to heal from burns. Some of the minerals that we need, we talked a little bit about minerals earlier, but calcium for bones, also muscle contraction, and clotting. We need calcium for clotting as well. Now phosphorus, remember there is an inverse relationship between calcium and phosphorus. So if your phosphorus is too high, your calcium will then be low, and vice versa. Phosphorus is also connected to bones and also cell permeability. We find that in dairy, eggs, and nuts. Fluoride is connected to dental health. Fluoride is often in the water supply. Iodine is connected to thyroid hormones, and we find that in iodized salt that's added to the salt. It's not in there naturally, and also in seafood. Sodium has to do with osmotic pressure, also our acid and base balance, and nerve transmission. Table salt contains sodium. Also canned vegetables are high in sodium, cured meats, processed food, and also milk contains sodium. Potassium also helps with our water balance. Potassium and sodium work together to form what's called the sodium-potassium pump that helps with the polarization of our cells. So we need both of those minerals to help our cells move, also with heart contraction. We find potassium in things like avocados, bananas, oranges, potatoes, spinach, tomatoes, and raisins. Iron. Remember that iron is what's in hemoglobin to carry our oxygen around, and we need iron to create hemoglobin and hemoglobin synthesis. So we find that in liver, leafy vegetables, and apricots. Now, MyPlate and the food pyramid are ways in which we can teach our patients to create healthy meals that are balanced and are created in a way that they're getting all of the things that they need in the correct amounts. If you look in your basics book, they refer to the choosemyplate.gov, which is the website that can help people to learn how to make good choices. And they use the My Food Plate, which is a chart that you'll find on page 207 in your basics book, which goes through the different food groups and food examples of each one, and the recommended daily intakes of each group. So it goes through the grains, vegetables, fruits, oils, milk, and meats and beans, and gives you examples of each food group, and then the recommended numbers for children, teens, young adults, and older adults. So please make sure that you look at those and review those amounts so that you can be familiar with those. Also pay attention to the examples in each one of those groups. So the food pyramid, when we're looking at that, grains, we need the most of the grains. At least half should be whole grains. Vegetables, emphasize different colors. They should be eating a variety of colors. Vegetables should be a rainbow. Fruits, fresh or frozen, or packaged in their own juice. We don't want fruits that are packaged in syrups or sugars. And oils, we only need a teaspoon a day. We don't want a lot of oils. Milk, dairy products, approximately 3 cups. And meats and beans, 5 to 6 ounces of lean meat, nuts, seeds, dried beans, fish, and eggs. Now, if your patient is a vegetarian, remember that for vegans, they exclude all sources of animal protein, fortified foods, and nutritional supplements. That would be a person who's not eating any animal proteins at all. Remember that they have to be careful about iron deficiency. They have to pay close attention to getting iron in their diet. They can get that from many sources. Remember that iron is in things like raisins, apricots. There are a lot of vegetable sources that they can get iron from, but because they're not eating any animal proteins, they've cut out a lot of the iron sources. A lacto-vegetarian is somebody that does include dairy products in their diet. An ovo-vegetarian includes eggs, and a lacto-ovo-vegetarian is like a vegan but includes eggs and dairy. People who are red meat abstainers do consider themselves vegetarian, but they eat all animal products except for red meat. Pesco-vegetarians consume seafood but no other sources of protein. So they would only consume things like fish and shrimp and shellfish, but no other sources of animal protein. So if you're choosing things for vegetarian, there are some people that are vegetarian, Seventh-day Adventists. If you look at your culture and religions section, you'll find that Seventh-day Adventists are vegetarians. They may have the B12 deficiency. Remember that B12 comes from animal sources. They may also have trouble with iron deficiency, as I said. Soy or meat analog like textured vegetable protein may be something that they consume to get their protein. Also, vegan diets are unable to sustain growth needs of children unless they're paying very close attention to getting their complete proteins and vitamins and minerals. It requires a very close attention. So stop the video here, review chapter 26 in your fundamentals book, and go through page 195 to 207 in the Kaplan Basics book. Then start the program again when you're on page 208 in the Kaplan Basics book, and we'll continue with therapeutic diets. Alright, so we're back, and now we're going to go on to therapeutic diets. So some of the therapeutic diets that we'll be talking about: clear liquids, which provides fluid and electrolytes, and is an initial feeding after a bowel rest, a bowel prep for surgery, post-op diet, or diet for diarrhea. Full liquids, which includes both clear liquids and opaque liquids, those that liquefy at body temperature, things like ice cream, sherbet, milk, pudding, mustard, strained soup, strained vegetable juices, and usually used for GI upset, nutrition without chewing. Mechanically altered diet or mechanically soft. This is a degree of texture, depends on the individual needs. Foods to avoid are nuts, dried fruit, raw fruits and vegetables, fried foods, chocolate, candy, tough and smoked or salted foods. Low fat, low cholesterol is for heart disease. Sodium restriction is for things like hypertension, avoiding canned, smoked, pickled, or luncheon meats. High roughage or high fiber Ostrikov High Res